Earlier, I spoke with Dr. Amir Afkhami about some of the issues surrounding mental health care. I asked him how the United States compares to other countries in terms of access to mental health treatment.
Access to mental health care is a problem, not only here in the United States, but actually, frankly, in developed countries. Let's take Canada, for example, our neighbor across the border to the north, with a national health service system. Only 1 out of 3 individuals with mental illness have access to mental health care. You see larger numbers here in the United States, larger disparities in terms of access to mental health, particularly in our adolescent and pediatric population, where over 80% of that population, particularly those adolescents with substance abuse problems, don't have access to mental health care. Now, why is that important? It's important because early access to mental health care can change the trajectory of mental illness as the person moves forward in their life cycle.
Now, is it also a question of people's attitudes towards mental health? I mean, to a large extent, there's still a great deal of stigma attached to people who have mental illnesses.
There is a great deal of stigma. It is getting better, but there continues to be a great deal of stigma when it comes to mental health issues. And this is true not only in underdeveloped countries, but throughout the developed world. A recent survey out of England looked at employers who and they were questioned on whether they were more likely to employ somebody with mental illness or less likely, and in comparison to physical illness. And those employers, about 40% of them said that they were likely to employ somebody with a physical illness, yet 60% of them, 20% more, said that they were less likely to employ somebody with a mental illness. Right. So a 20% change.
Yeah, and it's also people's own attitudes, isn't it? People who
Absolutely.
say, you know, I may be suffering from depression, or I may have some kind of anxiety complex of some kind, but I'll manage. I'll be
Absolutely.
okay.
There's a lot of stigma. In media, there's a, obviously, it's usually individuals with who perform some sort of a spectacular act, sadly more often than not violent act that generally is associated in the media with mental illness. Although this is completely untrue. Mentally ill individuals, particularly severely ill, mentally ill individuals, are less likely to commit an act of violence because most of them are impaired.
There have been some questions which have been raised over, I mean, the mass shootings that we've seen recently. I mean, you take the shootings at Sandy Hook, the Newtown shootings, the shootings at Navy Yard here in Washington, which were carried out by people who arguably had some kind of mental problem.
You know, we continue to have a problem with delivering care in our country. 60% of individuals in our mental health sector who have a mental illness who receive care through the public system. Of those 60%, a bulk of them are funded through the Medicaid system. And especially with the current recession and our current economic difficulties, one of the areas hardest hit in terms of public sector care delivery has been the Medicaid system and individuals with mental illness who have need for these community-based treatment facilities that are funded through Medicaid.
You know, here's an interesting figure that I saw. The United States spends around $113 billion on mental health treatment, and most of that is spent on outpatient care and prescription drugs. Should that change? Should there be more inpatient care?
Outpatient care is the gold standard in the way we see the future of psychiatry in this country, and it's frankly the way the perspective that's been replicated across the OECD and across industrial countries. The problem is that there is not enough outpatient resources. Because of this lack of resources and lack of funding, our prison systems, ironically, have become one of our biggest care delivery facilities when it comes to mental illness. It's worthwhile to think of new ways to address these difficult issues, both in terms of enhancing care for the patients and being more fiscally responsible, possibly by thinking about ways we can shift these types of individuals, individuals who are not receiving care or who are ending up in the prison system where they receive care, towards outpatient care and towards having more facilities that can deliver that type of care for them outside of our sort of prison and the legal framework.
Okay, so we're going to have to leave it there. Thanks for joining us.
Thank you.